Today we're going to be chatting about the benefits of chiropractic during your pregnancy, and specifically a technique we often utilize called the Webster Technique. Hi, my name is Dr. Brittany. I'm here with Bloomington Wellness Center, and today I'm here with Daniela. Daniela is 37 weeks pregnant. She's going to help us demonstrate the technique called the Webster Technique. So Daniela, I'm going to have you go ahead and stand up. And what we're going to do is adjust this table specifically for pregnant ladies. What we can do is drop this piece of the table down, and then we're also going to place a cushion underneath her hips to create more room for the baby. So Daniela, go ahead and we'll have you lay on your stomach. And you let me know if everything is comfortable.
Yes.
Good. Does that feel okay?
Mm-hmm.
Great. Okay, so at first, the first thing we're going to assess in the Webster Technique is Daniela's sacrum. The sacrum is this bone that sits right at the base of your spine between the two big bones of your pelvis. The reason this bone is important is because it has ligament connections to the uterus, and the uterus is, of course, where that baby is growing. So what I'm going to do for this assessment is I'm going to check Daniela's legs. You're going to feel me bending up your legs here, Daniela. You just relax. And what we're doing is checking for any restriction from side to side. As you can see, Daniela's very flexible. She's got a lot of good movement in here, which is great. But what you can see is that this left side has a lot more freedom of motion, and we've got a little bit of restriction in this right side of her pelvis. So what we're going to do to correct that, Daniela, I'm going to have you slowly come up to hands and knees here. Good. And then I'm just going to fix this table, and then we're going to have you go ahead and lay on your left side and face that way. All right, so what we're going to do here is a very specific adjustment. What we're going to do is free up some of this restriction in that right side of our sacrum. Okay, Danielle, go ahead and relax here. Keep in mind, this is just one specific way that we can do this adjustment. We've got lots of different ways we can do things. Okay, Danielle, go ahead and lay on your back. Great. Oops, there we go. All right, and the second thing we're going to assess for this Webster Technique is her round ligament. This ligament also has attachments to that uterus, and when it gets tight, what can happen is it can cause torsion in the uterus, which can then constrain the area that the baby has to grow and to position itself. So what I'm going to do is find that round ligament, and what we're going to do is just place some gentle pressure on there, usually about the amount of pressure that you're going to use to test for a ripe tomato. What we're going to do is just hold this pressure for about 30 seconds to a minute. And what you're going to feel for is for that ligament to relax. And once you feel that relaxed, then that technique is complete. Okay, Danielle, you can go ahead and sit up here with me. Great. Now, many patients often ask us when it's necessary for this technique to be done. If it's necessary to wait until you know that your baby is in breech presentation, what we always say is that it's very beneficial to get chiropractic care throughout your pregnancy. Both for the health of that baby and the balance in the pelvis to make sure that the mom and the baby are healthy, and also to help with any pain that pregnant moms often have, whether that be low back pain, mid back pain, or neck pain. So what we always recommend is that you get regular chiropractic care throughout your pregnancy. And if you have any more questions about that technique or about chiropractic care during pregnancy, please feel free to visit our website, www.wellbloomington.com. If you enjoyed watching this video, please share with your friends, and also feel free to subscribe to our channel for our weekly updates.